A very good evening to all of you. Today we will do the MCQs of orthopedics. Orthopedics has a weightage of about 10 questions in the NEET PG and about 8 to 10 questions in INICT. Some of the questions are asked in UPSC CMS also. So let us begin with the first question. It is a scoring subject. You can score full marks in orthopedics if you practice the previous year's MCQs and the most repeated topics. Let's begin. Identify the instrument. A. Elizarow's fixator. B. Rail fixator. C. K-nail. D. Proximal femoral nail. It is Elizarow's ring fixator. Elizarow's ring fixator, or it is rail fixator, or it is K-nail, or it is proximal femoral nail. Now let us one by one look at all the options. Elizarow's ring fixator was developed by Gavril Abramovich Elizarov, who described the law of tension stress, that is, principle of a new tissue develops between the distracted bone ends in 1950. Indications are for limb lengthening, orthodesis, infected non-union, and deformity correction, etc. Then rail fixator. Rail fixator, this is a monolateral fixator available in the form of rail or telescoping multi-joint assembly. In this, 6 mm pins are inserted into the bone. These pins are attached to different blocks which can move over a tract. According to note, the bone can be compressed or distracted as in Elizarow's ring fixator. However, it is less versatile as compared to Elizarow's fixator, and it cannot be used to all in the osteoporotic bone. It can be applied in compound fracture, limb lengthening, etc. Then proximal femoral nail anti-rotation device is a short intramedullary nail which is uses a spiral blade device to obtain fixation in the femoral head rather than the conventional screw. Kushner's intramedullary nail. It was developed by German surgeon Kushner for fixing fracture of shaft femur. It is hollow, incomplete tube. There is a slot or gap in the circumference of hole of nail, which allows it to bend slightly on the tensile surface of femur. So the correct answer here is B. It is a rail fixator. Identify the given splint. A. Dynamic finger splint. B. Sugar tongue splint. C. Cock-up splint. D. Knuckle bender splint. Well, it is a cock-up splint. Cock-up splint is a static wrist orthosis. It can be used in wrist pain, de Quervain's disease, Colles fracture, and carpal tunnel syndrome, wrist drop, and hemiplegia. Knuckle bender splint simultaneously flexes the metacarpophalangeal joints of all digits without blocking the interphalangeal or wrist motion. It is used in case of ulnar palsy. Dynamic cock-up splint. It extends the proximal interphalangeal joint, distal interphalangeal joint, and wrist joint passively while the patient flexes his wrist and fingers voluntarily. This is why it is called as dynamic split. It is used in radial nerve palsy and after transfer surgery. Sugar tongue splint of forearm. The sugar tongue splint is commonly used to immobilize forearm fractures, particularly the distal radius fracture at the wrist in patients in whom it is desirable to maintain the forearm in some degree of supination or pronation. So, sugar tongue splint is used for forearm fractures. Dynamic cock-up splint is used for radial nerve palsy and after transfer surgery. Knuckle bender splint is used for ulnar nerve palsy. Then cock-up splint. Cock-up splint is used for de Quervain's disease, Colles fracture, carpal tunnel syndrome, wrist drop, and hemiplegia. So the correct answer here is cock-up splint. A football player falls on an outstretched hand while kicking the ball and felt pain at the wrist joint immediately after falling. Falling. Identify the fracture. A. Galeazzi fracture. B. Colles fracture. C. Montegia fracture. And D. Rolando fracture. Now let us look at the options carefully. What is Galeazzi fracture? Galeazzi fracture is a fracture of lower one-third of radius with dislocation of distal radioulnar joint. Mechanism of injury is fall on the hand, probably with superimposed rotation force. Radius fractures in its lower third and inferior radioulnar joint subluxate. It is more common than Montague fracture. So the correct answer here is Galeazzi fracture. What is the use of given instrument? Well, it is a plate holding forceps. It is used for open reduction internal fixation. It is used to hold the plate in alignment while drilling and screw placement takes place. So what is the use of the given instrument? To hold the bone and plate. So the correct answer here is A. Earliest sign of compartment syndrome of leg is A. Tingling or numbness, B. Skin mottling, C. Pulselessness, D. Pain on passive stretch. Compartment syndrome is more common in lower limb. Fractures of elbow, forearm bone, proximal third of tibia, multiple fractures of hand or foot, crush injuries, and circumferential burns. Clinical feature characterized by pain with passive motion of finger and toe, pulselessness, pallor, paresthesia, poikilothermy, and paralysis. Pain out of proportion to clinical situation usually first symptom. Pain on passive stretching is most sensitive sign prior to onset of ischemia. Late signs of compartment syndrome, paralysis and pulselessness. Diagnosis, test, earliest sign of impending compartment syndrome, elevated compartment pressure. So the correct answer here is D, pain on passive stretching. What is the most common sequelae of traumatic shoulder dislocation in young adults? A. Frozen shoulder. B. Recurrent shoulder dislocation. C. Normal shoulder healing and movements. D. Subcapsular tendinitis. So this is the commonest joint in the human body to dislocate. It occurs more commonly in adults and rare in children. Anterior dislocation is much more common than posterior dislocation. So the correct answer here is B. Recurrent shoulder dislocation. In the fracture seen in the X-ray below, what is the most commonly expected vascular injury? A. Brachial artery, B. Radial artery, C. Ulnar artery, D. Cubital vein. It is a supracondylar fracture, so the artery which is involved is brachial artery. Please click the link in the description box to join the Ultimate NEET PG Breakthrough Blueprint Masterclass. This will be highly beneficial for you. It covers all the 19 subjects in a holistic manner so that your score improves in your final NEET PG exam, and it also devises a revision pattern for you so that you will be able to please join the WhatsApp group and be in the WhatsApp group till you get selected. What is the eponym for the fracture shown below? Galeazzi fracture, Montague fracture, Smith fracture, De Colles fracture. It is a Montague fracture. An athlete suffers a fracture as shown in the knee X-ray below. How is the fracture managed? A. Tension band wiring. B. Compression plating. C. Internal fixation. D. K-wire fixation. The given X-ray shows displaced transverse fracture of patella, which is treated by tension band wiring. So the correct answer here is tension band wiring. In displaced transverse fracture, the lateral expansions are torn and the entire extensor mechanism is disrupted. Operation is essential through a longitudinal incision. Fracture is exposed and the patella is repaired by tension band principle. The fragments are reduced and transfixed with two stiff K wires. Flexible wire is then looped tightly around the protruding K wires and over the front of patella. The tears in extensor expansion are then repaired. A plaster back slap or hinge brace is worn until active extension of knee is regained. Either may be removed every day to permit active knee flexion injuries exercises. So the correct answer here is tension band. Which part of second metatarsal is involved in March fracture? A. Head, B. Neck, C. Shaft, D. Base. March fracture, it is a stress fracture of shaft of second or third metatarsal. Stress fracture is due to imbalance between load and resistance of bone. It is of two types. Fatigue fracture is caused by application of abnormal stress on normal bone. Then insufficiency fracture caused by normal activity on a weak bone. March fracture is a stress fatigue fracture of second metatarsal neck followed by third metatarsal neck. The most common site is metatarsal neck followed by tibia. Proximal third in children, middle third in athlete, and lower third in elderly. Tibia stress fracture. So the correct answer here is B, neck, metatarsal neck. In which of the following is incorrect about PCL? A. It is main restraint in posterior drawer test. It is an extra synovial structure. C. It is main restraint to internal rotation. D. It originates from anterolateral aspect of medial femoral condyle in the area of intercondyle patch. The correct answer here is it is the main restraint to internal rotation. Now, this anterior cruciate ligament is an intracapsular, extrasynovial. This anterior cruciate ligament is a major stabilizer of knee. Its mechanism is to stabilize internal rotation and extension of tibia on femur. Its function is multiple in that it limits forward gliding of tibia on femur and limits hyperextension. It makes a significant contribution to lateral stability and limits anterolateral rotation of tibia on the femur. It is injured by occurrence of excessive movement when it limits. So the correct answer here is C. About giant cell tumor, all are true. A. Commonly presents in 20 to 40 years of age group. B. Matrix consists of proliferating mononuclear cells. C. Osteoclast giant cell constitutes the proliferative component of tumor. D. It is a benign tumor which may have lung metastasis. In giant cell tumor, osteoclast giant cells are malignant cells which induce the proliferation of mononuclear macrophage linear cells. Hence, the dividing cell population is the mononuclear cells which form the matrix. Osteoclast giant cells do not constitute the proliferative composition of the tumor. So the correct answer here is osteoclast giant cells. What is the diagnosis here? Here you can see it is a giant cell tumor. So the correct option here is B. Identify the tumor. Identify the deformity. A. Swan neck deformity. B. Bottoner deformity. C. Jersey finger. D. Mallet finger. It is a swan neck deformity. Rheumatoid arthritis is a chronic, non-suppurative inflammation of synovial joint. It occurs between the ages of 20 and 50 years. Women are affected about 3 times more commonly than men. It may present as acute symmetric polyarthritis, pain and stiffness in multiple joints, at least 4, particularly in the morning, mark the beginning of disease. This may be followed by frank symptoms of articular inflammation. The joint affected most commonly are the metacarpophalangeal joint, particularly that of index finger. The joints affected in rheumatoid arthritis are metacarpophalangeal joints of hand, proximal interphalangeal joint of fingers, then wrist, knee, elbow, ankles. The less common involved are hip joint and temporomandibular joint, and the uncommon are atlantoaxial joint, facet joints of cervical spine. The onset may be with fever, the cause of which cannot be established, that is, pyrexia of unknown origin, especially in children. Sometimes visceral manifestation of disease such as pneumonitis, rheumatoid nodules may antedate the joint complaints. The deformities in rheumatoid arthritis in hand are ulnar drift of hand, bottoner deformity, swan neck deformity. In elbow, there is flexion deformity. In the knee, in early stages, it is flexion deformity. In late stages, it is triple subluxation. In ankle, it is equinus deformity. In foot, hallux valgus, hammer toe. Radiological features of rheumatoid arthritis are reduced joint space, erosion of articular margins, subchondral cyst, juxta-articular rarefaction, soft tissue shadow at the level of joint because of joint diffusion or synovial hypertrophy, deformities of the hand and fingers. So the correct answer here is A, swan neck deformity. Glucosamine supplementation is given in A, arthritis, B, diabetes, C, cataract, D, asthma. It is given in arthritis. Patellar clunk syndrome scar is present at the superior pole of patella and impinging on the A, femoral component during flexion, B, femoral component during extension, C, inferior pole during flexion, superior pole during extension. Patellar clunk syndrome patient complains of clunking during knee flexion caused by suprapatellar fibrous nodule that interferes with patella movement. Many patients can be managed without surgery. However, if there are persistent symptoms, surgical excision of node can be useful. Irritation of lateral facet of patella, contact between the lateral facet of patella and femoral implant. So the correct answer here is femoral component during extension. B. Most specific for diagnosing of ankylosing spondylitis is A. HLA-B27, B. Bilateral sacroiliitis, C. Lumbar movement, D. ESR. It is bilateral sacroiliitis. What is the most likely cause of abnormality seen in wrist X-ray of the child shown below? A. Scaphoid fracture, B. Colles fracture, C. Osteoporosis, D. Rickets. It is rickets. A 75-year-old female had a fall and had intertrochanter fracture. This is due to A. Osteoporosis, osteopetrosis, Paget's disease, metastasis. It is osteoporosis. A 55-year-old male presents with severe backache for 10 days and urinary incontinence with a history of intervertebral lumbar disc prolapse. There is no history of fever or weight loss. What is the likely diagnosis? It is cauda equina syndrome. History of severe backache, urinary incontinence, intervertebral lumbar disc prolapse without any fever or weight loss is highly suggestive of cauda equina syndrome. The spinal cord terminates at around the level of L1, so compression here may involve the conus medullaris or cauda equina or both, giving a mixture of upper motor neuron and lower motor neuron sign. The typical cauda equina syndrome consists of lower limb weakness, absent reflexes, impaired sensation, and urinary retention. Cauda equina syndrome is characterized by low back pain, diminished sensation over buttock, posterior superior, thighs, and perineal area in saddle distribution. So the correct answer here is C, cauda equina syndrome. All of the following are true about Sprengel shoulder, except A. Associated with diastometamylia, B. Commonly associated with Klippel-Feil syndrome, usually associated with dextrocardia, associated with congenital scoliosis. Now, in Sprengel deformity, that is elevation of scapula, it is a most common congenital shoulder abnormality. Sprengel deformity is usually noticed at birth, asymmetry of shoulders with elevation and underdevelopment of affected side. Scapula is abnormally small and too high, associated with hypoplasia or atrophy of regional muscles. Elevated scapula is usually noticeable with restriction in motion of scapula and glenohumeral joint. So the correct answer here is C, usually associated with dextrocardia. What is the likely diagnosis of image shown below? Coxa magna, coxa valgava, coxa vara, coxa sultans. It is coxa vara. Myalgia paresthetica. This question has been repeated often. A. Lateral cutaneous nerve of thigh. B. Genitofemoral nerve. C. Ilioinguinal nerve. D. Saphenous nerve. It is lateral cutaneous nerve of thigh. Identify the deformity in the given picture. A. Hallux valgus. B. Hallux varus. Cubitus valgus. Rheumatoid nodule. It is hallux valgus. There is outward or lateral deviation of grade 2. Lateral deviation of proximal phalanx or metatarsal head. Most common foot deformity and probably of all musculoskeletal deformity occurs due to improper shoe wearing in majority of patients. There is lateral deviation and rotation of hallux with prominence of medial side of head. Haglund's deformity is seen in which joint?